Good evening, everyone. Thank you for coming. Tonight we're going to talk about a problem that a lot of women face. About a third of women in their reproductive years face a big issue with heavy bleeding, heavy periods, irregular periods. So we're going to try to cover some of those topics today and see if we can figure out how to diagnose them and how to treat them. So some of the things that we're going to talk about tonight are just kind of going over what are the definitions of what we're talking about, what female anatomy are we referring to when we're talking about where the problem is coming from. Try to identify some of the sources of bleeding that aren't dysfunctional uterine bleeding, that are patterns of irregular bleeding that I'll go over a little more in detail in a little while, as well as what is dysfunctional bleeding and what is its cause and why do we have problems with it. How do we go about diagnosing these issues, and then ultimately how do we go about treating them, because that's ultimately what we want to try to do and accomplish to get some women some relief. So definitions: normal menstrual flow. When we talk about what normal periods are, we have usually about a period a month for most women on average, as far as cycle time in between when we have our periods. So anywhere from about 28 to 30 days is normal for most women, but anywhere from 24 to 35 can be normal. And when you look at the numbers up here, 30 to 40 milliliters of blood per cycle, well, how the heck do I quantify that? I can't measure it, when it's happening. So, you're going through 3 or 4 pads or 3 or 4 tampons a day, or maybe a few more, or a few less, and that's pretty average. But when you start to talk about things that are abnormal or outside of the realm of normal, that's when we start to talk about this pathologic bleeding. So menorrhagia is heavy excessive bleeding. So it's a long period, it's a heavy period, it's more blood flow than you typically would see with normal cycles. And again, here's those numbers again, greater than 80. But when we're talking about quantifying this on something you can relate to, it's, am I going through 8, 10, 12 pads a day, or tampons a day, or more potentially? Am I soaking through pads, or things going into my clothes, things of that nature? And then you can talk about patterns of bleeding. So metrorrhagia is irregular bleeding, but it's not too heavy. Menometrorrhagia is a combination of both of those two evils. So you have heavy bleeding and it's irregular too. And this is kind of leaning more towards that dysfunctional uterine bleeding that we'll get to in a little bit. What does this mean for me? What does it translate to in my everyday life? So heavy bleeding with clots, I'm having some cramping, I'm having a hard time, sitting through my classes or sitting through my work or functioning. I'm having to carry around a purse full of, a box of Super Plus tampons and all these pads because I can't, make it 2 hours in between when I'm having to change those items. And then what happens that sometimes it's still not enough. I have breakthrough bleeding that goes through my pad or through my tampon. It swells my clothes. It impacts me socially. And then because of that reason, either because of the impact from the bleeding itself or from pain or from both, we miss work, we miss school, we miss social events, and it impacts our ability to go out during those 6, 7, 8, 10 days that we're having all this extra bleeding. And then in turn also this extra bleeding can lead to anemia. I have fatigue from this. I have decreased energy. It impacts my intimacy as well, my intimacy with my partner, because I have a week or more out of the month where I can't be intimate with my partner because I'm so uncomfortable I can't do so. So this dysfunctional uterine bleeding, this is this arbitrary kind of vague description of weird bleeding. What do I do with it? Where is it coming from? Well, dysfunctional uterine bleeding is a diagnosis of exclusion. So we look for all these things that we try to say, what is the reason? What is the cause? Why am I having these abnormal bleeding? And if I can't put a finger on a diagnosis or I can't identify a diagnosis, this is typically what we end up calling it as dysfunctional uterine bleeding. So it's extra bleeding, excessive bleeding. It's not cyclic. It doesn't come when it's supposed to. It doesn't happen that every time of the month type of a thing. It's irregular, and it's not because of other underlying problems. So it's not because of fibroids. It's not because of polyps. It's not because I have thyroid disease and that's making my period irregular. And it's typically because we don't ovulate normally. So if we have some reason where our ovaries aren't releasing an egg every month, which in turn triggers the normal cascade of hormones that cause us to stay on a normal cycle, then we'd get too much estrogen because our ovaries kick out too much of that, and then our bleeding gets all out of whack. We have periods that happen once every 45 days, and then it's 60 days, and then it's 10 days in between, and it's all over the place. And so if we can't find any other underlying reasons, this is the diagnosis that we end up with. So it's a diagnosis of exclusion. So what is the bleeding coming from? Well, this daggum uterus. So here's just a basic review of our general female anatomy. When we're talking about what we're looking at here, imagine slicing yourself in half, front to back, and this is the uterus sliced in half, front to back. So this whole item here is the uterus in total. The bottom part of here is the cervix. You can see the fallopian tubes coming off both sides, and the ovaries here out to the side, and this is the vagina. So obviously, if we're talking about bleeding, this is where it's going to come from, and this is where we're going to have intercourse and place our tampons, etc. But this is the booger in here, the endometrium. This is where all that tissue comes from that we bleed every month. This is what overgrows if we're having dysfunctional uterine bleeding. This is where polyps can hide. This is where fibroids can hide. And this is what ultimately will lead to whatever the problem or source is when we're having significantly heavy bleeding. So what are some of the things that we can identify? What are some of the things that we can rule out as not being dysfunctional uterine bleeding, or DUB for short? Well, we start from the outside in. So we have to identify the female organs that we want to make sure are not a source. So the external genitalia, so the vulva or the labia, are there skin tags, are there warts, are there herpes, has there been trauma to this area or cancer that might be bleeding from that's not actually coming from within the uterus? And along those same lines, the vagina, are there items in the vagina that could potentially be attributing to it? And so working our way up, we started from the bottom, going from the vagina up towards the cervix. So yep, the cervix can have polyps too. There can be endometriosis sitting on that cervix. You can have infection of the cervix, back to the cancer and trauma. And then well, here's the uterus. We got to get up to this uterus and see if this is the actual source. Well, even if it's not dysfunctional uterine bleeding, you can still have items within the uterus that are abnormal. The upper genital tract is a less common cause of abnormal bleeding, but it still can be a source. You can have cancer in the fallopian tube or on the ovary that can cause bleeding that's abnormal, or even infection within the tubes in the ovaries themselves. There's other things outside of even our anatomy that can cause these problems as well that we also want to make sure we're ruling out. So in your own personal history, am I on a medication that may be causing my bleeding to be abnormal? Some people just have intrinsic bleeding disorders like hemophilia, or problems with clotting disorders or leukemias where they might bleed irregularly just as a baseline, as well as easily bleeding from cuts and bruising. Systemic diseases, PCOS or polycystic ovarian syndrome, is a really, really common cause of erratic, irregular, heavy bleeding. There's no rhyme and reason to when we have our cycles. And this is something that we can diagnose both with ultrasound as well as with lab results that we check on women who are having these irregular cycles to see if that's the underlying cause. So what do? Where do we get started? How do we figure all this out? The first place to start is figuring out what your periods are like. So are you having normal, regular cyclic periods, or are they irregular? Are they happening every 10 days, every 20 days, every 45 days, twice a year maybe? And then quantify, if you can, how much bleeding you're having. If you sit down and you say, man, I go through a box and a half of tampons every single time I have a period, that's excessive. And then looking, obviously, in the world that we live in as gynecologists, doing the pelvic exam, getting a pap smear, making sure there's no cervical cancer there, and making sure there's no infection as a source of the bleeding as well. So imaging. We got to get an ultrasound. We're GYNs. We like to look at the uterus. We like to look at the ovaries. We like to make sure everything's okay. And so if you think back to that first picture where we looked at the anatomy of the female reproductive organs, the endometrium, that lining of the inside of the uterus, that's what we want to make sure we see very well. Is it thickened? Is it irregular in appearance? Is it not a nice, smooth line like it's supposed to be? Well, if we put a little saline or a little salt water inside the uterus while we're looking, lo and behold, look there. There's a huge polyp sitting in there, sitting inside the uterus that can be an easily identifiable source of abnormal bleeding. Back before, when we looked and saw potential sources of abnormal bleeding as endometrial cancer, endometrial hyperplasia, precancerous changes, how do we determine if that's there or not? So an endometrial biopsy is a test that we can perform to take a small sample of tissue from within that endometrial cavity, like we talked about before, to see if there is any cell change. Is there any precancerous or cancerous change? Sometimes we can even nick a little piece of a polyp while we're in there and see if we can detect maybe even a little bit of old infection that's just kind of been brewing inside the uterus and causing that abnormal bleeding to be going on for a while, and that's our way to do this in the office. So this is done in the same manner as a pelvic exam with a pap smear is done, only a skinny little catheter is placed in through the cervix to sample the tissue inside the uterus. A little bit of a next step, which is a small surgical procedure to do an evaluation of the inside of the uterine cavity, is called hysteroscopy. So if you've heard of laparoscopy before, that's the kind of surgery where a small camera is used that's slid through an incision either in the belly button or somewhere else in the person's anatomy. And we use the same kind of equipment in gynecology, only we have a nice natural orifice that we can use to place this camera without even having to make an incision. So we slide the camera in through the cervix, and we can look inside the uterine cavity to see, is there a polyp in there? Is a fibroid in there? Or we can also beneficially use the same kind of equipment to treat those pathologies as well.